We understand stepping into the ICU for the first time can feel like you're entering a different world. It's okay to be anxious. You might feel like a deer caught in the headlights, your heart pounding, a surge of adrenaline rushing through your veins. But let's pause for a moment and remember you're not alone. Many healthcare professionals just like you have felt this mix of anticipation and anxiety, the weight of responsibility, the fear of making a mistake. It's a whirlwind, but it's also a rite of passage. It's your first step into a world that will challenge you, change you, and ultimately shape you into the healthcare professional you aspire to be. With each passing day, you'll gain experience and with it, confidence. You'll learn, grow, and adapt. You'll make a difference, one patient at a time. Remember, every seasoned ICU professional was once in your shoes. Preparation is key to conquering the first day jitters. Here are some steps you can take to prepare. First and foremost, ensure you get a good night's sleep. Rest is paramount to functioning well in the fast-paced, high-stress environment of the ICU. Next, take time to review common ICU procedures. Refresh your memory on the basics and look into the specifics of procedures you may not be familiar with. Knowledge is power, and in the ICU, it can make all the difference. Familiarize yourself with the ICU layout. Knowing where everything is will save you precious time when every second counts. Bring a notebook along. Jot down important information, procedures, or advice from colleagues. Remember, no question is too trivial when it comes to patient care. Above all, remember to take care of yourself. You can't pour from an empty cup. Preparation is your first line of defense against the unknown. The big day is here. Here's a simple step-by-step guide to navigating your first day in the ICU. First and foremost, make sure to arrive early. This gives you time to familiarize yourself with the environment and shows your commitment to the team. Next, introduce yourself. It's crucial to establish rapport with your colleagues from the get-go. They are your lifelines in this high-stakes environment. Thirdly, don't be afraid to ask questions. There's no such thing as a silly question in the ICU. The more information you have, the better equipped you'll be to make sound decisions. Furthermore, take notes. It will help you remember important details and procedures. Above all, remember that patient care is paramount. Stay calm under pressure and focus on providing the best possible care for your patients. Remember, it's not about doing everything perfectly on your first day, but about learning and adapting. Let's recap the main points from this video to help you navigate your first day in the ICU. First off, it's completely normal to feel anxious. You're stepping into a new environment with its own set of challenges. But remember, this is also a place of healing and hope. Preparation is key. Brush up on your medical knowledge, understand the ICU protocols, and familiarize yourself with the layout of the unit. The more prepared you are, the more confident you'll feel. Your first day will be a whirlwind, but we've provided a step-by-step guide to help you through. You'll be taking patient histories, performing physical exams, making treatment plans, and communicating with the healthcare team. It may feel overwhelming, but you're not alone. And finally, take care of yourself. This job can be taxing, both physically and emotionally. Remember to take breaks, hydrate, and seek support when needed. You're embarking on a rewarding journey. Embrace the learning curve and remember to take care of yourself too. Now that we've covered the first day, let's talk about what a typical day in the ICU looks like. It starts early in the morning with a huddle. This is where you and your team will discuss the status of each patient and plan for the day. Following this, you'll perform rounds, reviewing the progress of each patient, adjusting treatment plans as necessary, and making sure everyone in your care is comfortable and understood. There will be moments of high intensity as you attend to emergencies, perform procedures, and communicate with patients' families. These moments are challenging, but they're also where you'll find the most growth as a professional. And remember, every day in the ICU is a new day, with its own unique challenges and rewards. In the midst of all this, don't forget the key takeaways we discussed earlier. Keep your knowledge up to date, follow the protocols, communicate effectively, take care of yourself, and always remember the hope and healing that you're a part of. Every day is a new opportunity to learn and grow as an ICU professional. Embrace this journey with all its ups and downs, and know that you're making a difference.